Okay, this video is, can dementia be reversed? Okay, and the answer is it depends, and yes, to some degree. So I'm going to explain what component of dementia should be reversible and what component probably is not. First thing we'll talk about is something in the heart because it's directly relevant to the brain. This concept of hibernating myocardium and stunned myocardium. So let's say you have a normal heart with normal contractility, percent of a normal value, regional cardiac function. All of this light kind of red heart is contracting normally. Then the patient has ischemia, narrowing of the artery, let's say left anterior descending coronary artery. And now this muscle at the tip of the heart is severely dysfunctional, and the adjacent part, as it's also kind of darkly colored, is also not functioning well. So you got an atherosclerosis stenosis here. This is atherosclerotic plaque, the yellow stuff here. Then you come in with an angioplasty balloon, maybe a stent, you plaster it up against the sides. Now you got more blood going through there, through this left anterior descending. Let's say it was a vertically orientated stenosis. And you open the vessel up again. You'll gradually get increased restoration of function in that heart muscle that was still alive. So what hibernated myocardium, stunned myocardium means, it's heart muscle that's not functioning well, but it's still viable. It's still alive and can be brought back to life, brought back to normal function. That's our concept, okay? And, I'm really a brain doctor. I just wanted to make the point because a lot of people have heard of stunned myocardium. A lot of people have heard of hibernating myocardium, that sort of thing. The idea that something is, dysfunctional but not dead, okay? And it's a little bit like Dryden's poem, I am only wounded and not slain. I shall rise again. And I shall lie a while and bleed a little and then rise to fight again. Okay, so anyways, what am I trying to say here? In this picture here, now here's a brain. Let's say a person has just had a stroke. The black circle in the center is the stroke. It is the dead brain, the core of necrotic tissue, of infarcted brain. It's dead. This parrot is dead. It's not coming back. Okay, but the point is that encircling it circumferentially is a penumbra. Penumbra in Greek means gray. Okay, this is the cerebral cortex, little gray matter ribbon. It's sort of brown in this picture. Deep white matter is in the center. Okay, but anyways, this is dead brain. It's gone forever. And so you can't get that back. That's irreversible. But the surrounding brain, the penumbra, it has enough blood supply to keep it alive, but not enough blood supply to function completely normally. This brain could be saved. If you can restore blood flow to this area, you could save the penumbra. So the function that's encapsulated in those neurons could be restored. And what I'm trying to tell you here with this talk today is there's tons of penumbra-like brain, okay? And that could potentially be saved. So there is a logical, medical, true, reasonable mechanism to save brain tissue. So here's a patient who had a stroke. Let's say they had atrial fibrillation, they tossed a clot, this black thing sitting in the normally red artery. The filling defect here is occlusion. This is the right middle cerebral artery, actually the M1 segment of the right middle cerebral artery. And this circle here is the dead brain. You call it the core infarct, meaning dead brain. Then distal to that is brain tissue that is underperfused, undersupplied, and that is the penumbra. Again, that means twilight in Greek. And that brain tissue is dysfunctional because it doesn't have enough blood, but it's not dead yet. Now it gets some collateral flow that wraps around the top. So this is the internal carotid artery, comes up into the brain, right side. You can always tell it's right side because it's as if the patient's feet are towards you. Then the middle cerebral artery, we talked about that being occluded by a clot, an embolus. I mean, it tossed from the heart up to the brain from atrial fibrillation. This right here is the anterior cerebral artery, and it goes up around the top of the brain, the cerebral convexity, because it's convex outward, and it provides blood to the penumbra. So it's keeping the penumbra alive. And so if you optimize everything you're doing, optimize blood flow, eating a low-fat, low-sodium, vegan diet with no oil, you're going to get more blood flow to the penumbra. You could potentially restore it. other things help protect it. I'll explain why, but eating adequate amount of dietary fiber protects it, because fiber is used to make short-chain fatty acids by the good gut bacteria, and then that butyrate goes to the gut to make tight junctions to prevent leaky gut, which also is good for the brain. Also, some of that butyrate travels through the blood up to the brain, and it's used to make tight junctions on the blood-brain barrier, the blood-brain barrier endothelial cells. Okay, so adequate dietary fiber protects the brain. Low-fat vegan diet protects the brain because it improves blood flow. It's got potassium, it's got potassium, magnesium, and plant nitrates that are all vasodilators, increase blood flow to that segment. Okay, so those neurons could potentially have their function restored. Now I'm going to go into more details here. And then you heard me say a moment ago, lots of people got tons of penumbra that could potentially be restored. Here's a normal looking brain. This is what's called a flare sequence. It's really like a fat saturated T2 sequence. All that means is on T2 fluid is bright, but on flare sequence you suppress the signal of the cerebral spinal fluid in the ventricles and in the convexities, okay, in the outer subarachnoid space. So what that means is this is a normal brain. There's no white spots in the brain parenchyma. And the ventricles are normal in size. Now this is like a normal looking brain for your typical 40-year-old. 40-year-old and younger brain looks like this, okay? Here is a bad looking brain of what should be, like a 110-year-old. But I see brains like this all the time in people in their 60s and 70s and 80s, okay? Don't get me wrong, I see a lot of good looking brains in people of that age too, but the vast majority look kind of crappy, kind of like this, or just severely atrophic. Atrophy is more common than these white matter small strokes. We often call these silent strokes or, white matter strokes. Anyways, here's my point. This brain is dead. That's all white and bright in signal, okay? But surrounding each one of these infarcts is a penumbra. And I have a paper that shows you that's true because they got more sensitive techniques now where they can really detect subtle amounts of contrast uptake from the gadolinium IV contrast of MRI. And so what I'm trying to tell you is circumferentially around each one of these infarcts is penumbra tissue that's not functioning optimally but could potentially be restored. So all of that brain tissue is potentially recoverable. Okay, and this is a big deal because this is common stuff. The so-called reversible causes of dementia, like, communicating hydrocephalus, also called NPH, normal pressure hydrocephalus. I see one of those patients get saved about once a year. And then the so-called, big meningioma, brain tumor pushing on the brain, you take it out surgically and then cognitive function is restored. I see that happen about once every 15 years. That's rare stuff. Okay, this, I see it every single day. So what I'm saying is that should be your goal. Maybe you've got some penumbra. Can you restore it back to function? Okay? And I would think most of us probably do have some. Some of us have lots and lots, and it could potentially be restored to function. It would be wise to go for it. And you restore it to function by improving its blood supply and improving the integrity of its blood-brain barrier. Blood-brain barrier is improved by eating your dietary fiber and avoiding the things that damage the gut. I've made entire videos about that. And getting your plant foods. So you get all your low-fat, you get your potassium, your magnesium, and your nitrates, your plant nitrates. Okay, those help restore flow. I got a couple more slides here, I think. Yeah, here's a paper I wanted to show you that talks about this. Blood-brain barrier failure as a core mechanism in cerebral small vessel disease and dementia. So increased white matter hypertensities are associated with increased blood-brain barrier leak circumferentially around themselves, and this leads to decreased cognition if you follow them up at 1 year. Okay, so this is a really good paper here. You're welcome to look up this paper for yourself. You see what I'm talking about. Okay, and then, like I said, by having here the paper knows that a slight decline in blood-brain barrier function could result in neurotoxins having access to your brain. You don't want that. Okay, because here's what happens when you don't have a good blood-brain barrier. I'm going to move, meant to move myself, not that. Okay, when you don't have a good blood-brain barrier, you got leaky gut. It usually means you have a lack of butyrate So you're going to have a lack of blood-brain barrier integrity as well. So you have increased permeability of the blood-brain barrier. So these bacterial endotoxins, they get through leaky gut, they travel through the blood, and they get through the leaky blood-brain barrier, and they damage the brain tissue because they bind the microglia, the security guards of the brain. They're the brain macrophages, if you will, part of the immune system. They got pattern recognition receptors that bind to the bacterial endotoxins, LPS from gram-negative bacteria, lipopolysaccharide, LTA, lipoteichoic acid from gram-positive bacteria. The microglia binds it and it goes, uh-oh, incoming bacterial invasion of the brain, must neutralize this, and they release tons of toxic chemicals to kill the bacteria that they think is invading the brain. And what they do is their goal is to sterilize the area around themselves, their vicinity, to prevent a bacterial invasion. And what they're doing, though, is they're destroying the neurons in that vicinity, the collateral damage, so to speak. So what I'm saying is by eating your fiber, you don't get leaky blood-brain barrier, and you don't get this problem. So that's wonderful. So, once again, the low-fat, low-sodium, plant-based diet, all organic, single ingredient, whole foods only, with no oil, it protects your brain. So this can help you a lot. There's other things you can do to improve your brain. I don't know if I got any more slides to that effect. I thought I had one more slide. Maybe not. Oh, here it is. Well, this is one of my slides. I had another one that I think I forgot, though. So this is just showing that you need the butyrate from the high-fiber diet. They just wrote short-chain fatty acid. They really should have wrote butyrate, and that maintains your blood-brain barrier. All right. And that should be done post-stroke. That should be done post-traumatic brain injury, but no one knows that. I teach this to neurologists, by the way. I'm the one who figured all this stuff out. And the other things that help the brain, you exercise. You get brain-derived neurotropic growth factor from exercise, also from studying, also from intelligent conversations. And that helps your neurons to form new synapses, new connections, okay? But restoration of old neurons will help you keep old memories. Development of new connections and all that helps you to learn new stuff. But exercise helps, good social interactions, intelligent conversations, getting your sleep, all of those things are helpful. But I just wanted to make the point. There is a good rationale for restoration of some cognitive function. But once you've destroyed all the neurons that have those precious memories, you're not going to get that back. You can restore as much penumbra type tissue as possible. See what happens, It's worth a try, but I'm letting you know there's a reason to have a growth mindset here, a Carol Dweck growth mindset, that you could potentially get back a significant amount of function. And if you're disappointed in your current cognitive function, this will help you to minimize your brain fog, as well as all the other stuff I talked about before, avoiding all the mitochondrial inhibitors, all that kind of stuff. I got a whole bunch of lectures on how to raise IQ and all that. So anyways, I thought that was interesting. I hope you found it helpful. I think that's my last slide. I'm pretty sure it is. Let me just make sure. I'll bet it is. Yep, that's it. Okay, thanks.